Hey there, I am Dr. Anthony Dakpala, your friendly radiologist. And today we are talking about something that is truly life saving. So, what if I told you that stroke, one of the most feared medical emergencies, can sometimes be treated without surgery? Yes, that is the magic of interventional radiology. Let's talk about how radiologists can actually get into your blood vessels and remove a clot or even put a stent in and help to save a brain without a single surgical cut. So, what really happens during a stroke? Let's explain that to you first. So, a stroke happens when blood flowing to the brain is suddenly cut off, and this can happen in any part of the brain. Depending on the part of the brain that does not have this blood flowing to it, you may have various symptoms. Usually, the brain needs oxygen, which is being carried by your blood cells. And so, when this happens, we develop symptoms like a drooping face, or maybe one part of the body may not be working, or the person may even be confused or may have what we call a slurred speech. Or maybe the person might even collapse all of a sudden. And this is all because there is no supply of blood or oxygen to a particular part of your brain. And so, what do we say? We usually say that time is of the essence, or time is brain. Every minute counts when it comes to a stroke. So, what do we usually do when someone gets a stroke and comes to us? Well, the old ways have been that we would give you what we call thrombolytics. And these are medications that are capable of breaking the blood clots. However, they come with its challenges. And some of the challenges are that maybe the patient might not have come quite early, or maybe it might not have been very effective. By that is, it may not have been able to reach exactly where the clot is to break it as effectively as possible. And so, what do we do here? This is where interventional radiology becomes very important, okay? Because when a patient comes in, an interventional radiologist is able to assess a blood vessel, and using his instruments, which includes a catheter, and then of course we may need a cath lab, where we like an imaging device like maybe a sort of a CT, and then we would also need of course the interventional radiologist will have to be available. So using these certain techniques, we are able to get into the blood vessel and then track all the way from where we've assessed the blood vessel, which may be even in your thigh, right? So all the way from the thigh to wherever we have the clot. And once we are able to get to where the clot is, under image guidance, we are able to take out the clot manually. So we don't really need to use the medications to break the clot. So we just take it out. Or if maybe what is causing the problem is a narrowing, we can put in what we call a stent. Now, when this is done on time, we are able to restore blood flow to whichever part of the brain has been affected. And so, it's important that when you suspect a patient or someone to have a stroke, you come to the hospital as early as possible. And usually the window period we give is 4.5 hours. If you can come earlier, it's better. Now, how would you even know that this patient has a stroke? Earlier, I said that the patient may have maybe a drooping face, where you may have one side of the face slanted. And so when the person is talking, you notice that one part of the mouth is moving, but the other part It's not. Well, I'm trying to demonstrate it here, but it's a little bit difficult because both sides are moving. But then one side will be slanted downwards, and then the other side would be moving. Then you may also have the patient having weakness on one side of the body. So it could be on the left side, hand side, or it could be on the right hand side. So maybe the patient tells you that I cannot move my right hand or my right leg, and that should raise suspicion. Also, you might have some other people collapsing all of a sudden, and then some people may also become confused all of a sudden, and this is because of what's happening up there in the brain, you know. And so I think we've spoken about most of the things that happen when we have a stroke patient. This stroke is a treatable disease if you are able to make it early to the hospital, especially in areas where we have interventional radiology. Now, I'm going to put, I'm going to say something here. Not every country has interventional radiology at its peak, So, in certain countries, like my country, we have just a few interventional radiologists, and so sometimes that's where the challenge may come. We may not be able to have access for everybody at the same time, but then I'm sure that as time goes on and more interventional radiologists are introduced into the system, we should be able to benefit from these things. So let's have hope that this would happen. Now, when we intervene by using interventional radiology, what happens? What do we expect to see? Usually, you may see a total reversal of whatever insults happened in the brain. So, let's say that as a result of what happened in the brain, the person was not able to walk. The person might, after the intervention, be able to walk again normally, like as though nothing has happened. If there was some subtle damage already, that's where you may have problems recovering. So interventional radiology is a very important part of our modern day medicine, and we should take that seriously. So what is our take home? Our take home is that strokes are emergencies, and then do not wait to get help. Get help as soon as you realize that somebody may have a stroke. And interventional radiology can make the difference, but only if you get to the hospital in time. So now, radiologists don't just read scans. Sometimes we save lives through them. I am Dr. Anthony Dakbala, your friendly radiologist, and I hope this helped you understand how modern imaging is changing the future of stroke care. If you found this useful and helpful, hit the like button and share with someone who needs to hear it. I'll see you in the next episode. And please don't forget to subscribe. Thank you.